The left one, we're going to do traction first. Going to just pull it up like that. And this is the right arm. I'm going to hold this bone up here, the humerus, and I'm going to grab the bone at the base of the thumb with this kind of grip. See, I'm making a C with my hand, or a backwards C. And I'm going to grab that bone and get your patient to relax. And you'll stabilize hard down here. And here I'm just going to pull. And I might jiggle. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And relax. And I kind of readjust. Make sure I got good stability there. Your thumb over here can monitor if you want to. I can kind of spin that bone until I feel it, like we learned about finding it. And it can just sort of sit there and monitor. And as you pull, you might be able to feel a little gap. Like that. And you pull. 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4. And maybe you do that about 10 or 15 times, so you get 100 to 150 little jiggles on the joint. And that's that direction. Now that same bone, we talked about trying to move it forward and backwards. So let's work on the backwards, this being the left side. So I'm going to grab here. I'm going to stabilize these other bones so they don't move, and I'm going to push that way. Here's my thumb. You have to get this muscle kind of out of the way. Here, like that. And then I'm going to take my hand back here, cup that, kind of hold it like that, back here. And you dig right in deep. So that muscle is all on the other side, and you let the hand relax on your lap. And if you go deep enough, you'll feel like a little bone. And my finger over here is sort of monitoring right where I felt that little spinny bone. There it is. So it's like I'm grabbing either side of it a little bit. My other hand stabilizes those, and I'm going to go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Sometimes my thumb isn't enough force, and I do this. I reinforce it. 1, 2, 3, 6, 7, 8, 9, 10. Sometimes I get real fancy and I put the hand right here on my side and I squeeze it and I go a little bit of traction. I just sort of pull back a little bit when I do that. Okay, and you do about, again, 10 or 15 10 repetition jiggles, and it's pretty firm. Now let's talk about moving it the other way. So we moved it back. Let's talk about moving it sort of forward or towards the midline a little bit. Again, you find it right like that. You can find that little bone. You feel it twist a little bit. And this one, you're going to get your thumb on it like so. You'll feel the joint line. It'll kind of dip right there, and here's a little bump. There's another bump above, so you want to kind of be on the lower bump. And reinforce it with your thumbs. And you're kind of pushing that way. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. One, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay? Like that. And that takes care of the motions in that joint. The last one is the motion in the sort of hook joint of what we call the ulna, which is this being the left arm. Again, this is the inner bone. And you can see how it's kind of a hook hinge. And so if I follow the inner bone back, and it comes kind of behind the elbow, you imagine it cupping back there, doing that same motion. And it's right in there that you want to grab. I find you got to kind of bend the elbow, and you'll feel it kind of go into that groove. And you can kind of grab the very end of it. I grab with your left arm on his left fingers on his his right elbow. And I'm resting this on my chest. I'm sitting here, and my hand is going to come here. My elbow is up towards his nose. And relaxing there. And then the force is down this way. I'm resting his hand on my chin here, and my chest.
Okay.
I'm hooking that with my fingers and try and relax. Great. And then I'm pushing this way with my hand. My chin is pushing the other way, using it kind of like a lever. And then this is doing a little bit of an extra pull on that bone. Wiggle, wiggle, wiggle. And you can either hold that or jiggle it. Feel okay?
Mm-hmm.
10. And I might try slightly different angles. And those are all of the moves that we've been doing. Okay,
Okay.
good.
All right.